Okay, we're covering Toggle week 6 today. We started off by discussing how, like the biomechanics of the spine as you rotate or laterally flex the head. Dr. Franz used right rotation and right lateral flexion to show it. So if you rotate the head to the right, the atlas will rotate posterior, so it goes back. The axis body will rotate to the right. C2 spinous process will rotate to the left, obviously, since the body is rotating to the right. And the cervical curve will appear to decrease. Pretty much it's the same with lateral flexion. If you lateral flex to the right, the atlas will rotate posterior, the axis body will rotate to the right, and the C2 spinous will rotate to the left. He also went over visual analysis. So if you're looking at an X-ray and you're trying to determine whether or not there's rotation in it, the ocular orbit on the APOM compared to the lateral rim of the skull will be off-center. Like one orbit will appear bigger than the other. The nasal septum and the IOP and the medial incisors will all be different links. And the mastoid processes will also appear out of alignment. With head tilt, the mastoid process, one's going to appear a little higher than the other. The occipital shelf will be at an angle, and same with the ocular orbit, so it will also be at an angle. Dr. Franz then showed us an APOM view to determine laterality and anteriority and what were the differences between different aspects of it based on the fact that we only had to take one film. So rather than just, like, this is for full analysis rather than just line drawing. So you want to do this before you put any lines on the page. So with laterality, we're going to look at the interodontoid space. So this space right here. And you want to look to see if one side's larger than the other. You're going to look at the occiput and the atlas joint space, so right here. Again, is it closer? Like this is pretty close to each other, but you want to see if one is a little bit closer to the top than the other. If it's laterally, if there's a little laterality to it, the TP may appear a little bit closer to the mastoid. The lateral mass might be overriding the condyle, so if you look up here, it would be out past the condyle. And the last one is the lateral mass in the C2 space will be closer on one side than the other. Anteriority is a little bit similar in most aspects. The interodontoid space is going to be smaller on the side of anteriority. The occiput and atlas joint space is going to be narrowed. The lateral mass will appear larger and more dense. The transverse foramen will look occluded, so if you have anteriority, it's going to be rotated, and so the transverse process will look a little bit more cylindrical. You'll also, so you'll have a small round TP, and the foramen will be cut off. The posterior tubercle will be rotated, so it'll be on one side compared to the other, and the posterior arch will appear a little bit thicker. We also discussed the atlas plane line and how to fix rotation in the neck. So if you were looking at a X-ray and you see the spinous is at an angle off to the side, that indicate that they had rotation and it wasn't compensated for. It has to be at an angle because as you rotate the head, the spinuses move. The top ones move further than the lower ones. If there's proper compensation, the spinous processes will align along the median plane line on the APOM view. And if there's overcompensation, they'll all be in a row, but they won't be anywhere near the the median plane line. Besides that, Dr. Franz decided to go into some differences between the vertebral foramen size and how much space it actually occupies depending on which vertebral segment they're at. And the lumbar spine occupies 1/3 of the canal. In the thoracics or dorsal spine, it takes up 1/12, and in the cervicals, it takes up 1/5. At the atlas segment, the vertebral it's divided in 3 sections, and you have the dens, you have some space, and you have the canal. And since everybody has a dens, then you can just eliminate 1/3, and you have 2/3 left. So the vertebral canal, spinal canal takes up half of the space that's left. So and he's using that as a point to come across that the atlas is most likely the only place that nerve pressure can occur, at least the most easiest. This week we have an assignment for reading in volume 18, it's chapters 12 and 13. So read up on that. Hopefully the quiz won't be too difficult. Thank you. Have a good week.